So one simple one, pinprick, would be taking this super fancy piece of equipment, which is a paperclip. You got a dull side, you got a sharp side, and then you can just go down in nerve distributions and say, have a patient, maybe you have them close their eyes so they ain't cheating, sharper dull, sharper dull, sharper dull, and you're just having that patient go throughout that nerve root distribution. And then lastly, you can have coins. And this is one Nina had described in her work where we use a coin to determine if the person's got some thermal detection threshold issues. So you'd have one of these in your pocket that would ideally bring a coin up to body temperature. And then you'd have a coin that maybe is sitting out at room temperature, which would be cool or cold. So we're going to place the room temperature coin on the lateral arm. Remember, the room temperature coin is the one that should be perceived as cooler. We're going to palpate it on the lateral arm. Then we're going to immediately place it on the palmar tip of the index finger. And what we'll do with that is, does this feel the same, colder, or warmer than your upper arm? And then the interpretation of this is basically if the fingertip feels warmer or less cold, then this might be a possible cold detection deficit. Now, if we look at a warm detection procedure, you may have guessed this, you're going to grab the one out of your pocket that's body temperature that should be warmed, and you're going to place that warm coin on the lateral upper arm. Again, you could maybe do this in the thigh and then into the distal toes for somebody with lower extremity. Then you're going to place it on the palmar index fingertip and ask the patient, does this feel the same, colder, or warmer than your upper extremity? Then the interpretation of this would be if the fingertip feels colder or less warm, possible warm detection deficit. So our clinical tip with this one would be try not to use leading language or things that are, is it better, is it worse, is it colder, is it warmer? You just let the patient, you give them some choices and they choose versus you lead them to a choice. And patients sometimes can be people pleasers and maybe give you answers they think you want to hear versus maybe a more true objective thing. And remember too, the lateral upper arm just acts as a control site. It's less commonly affected with a neuropathy. So it's something that can be something that often we wouldn't expect to have neuropathy. But in the case where we might have a patient where we're thinking for whatever reason their small fiber issue might be more than just in the distal extremities, then obviously we would want to try to find a different control site for that person.